Good morning, everybody, and welcome to our Avoid Vaping Fast Facts Webinar, Part 5. I appreciate you sticking with us through some technical difficulties, but we're up and running now and happy that you're here with us. Today we actually have a guest speaker. Natasha Phelps is a senior staff attorney at the Public Health Law Center, where she provides legal technical assistance on commercial tobacco control issues to public health professionals and organizations throughout the United States. And I heard Natasha's colleagues speak at the National Conference on Tobacco or Health in Minneapolis a few months ago, and knew she'd have some great insights to share with us today. Today she's going to be speaking about school-based policies addressing commercial tobacco use, and we're happy to have her here today. So Natasha, I'll ask you to take it away. One just quick reminder to the audience, if you do have a question, you'll see a box on your screen that you can type that question. Once Natasha finishes her presentation, I will have a quick discussion with her about some of the stuff she presents and also ask her any of the questions you submit. So thank you so much for joining us today, Natasha. Please take it away.
Okay, great. Well, thank you so much for inviting me to join the call to talk today briefly about addressing the vaping epidemic and commercial tobacco use in schools. And specifically today, we're going to be talking about K-12 schools and some of the best practices that schools can adopt when it comes to a commercial tobacco-free policy. So just really quickly, for those of you who don't know, my name is Natasha Phelps. I work at the Public Health Law Center. We're a nonprofit legal center located in St. Paul, Minnesota, on the traditional lands of the Dakota people. What we do at the Public Health Law Center is provide free legal technical assistance. So anybody who's on the phone call today who are hoping to look into this issue, whether it's a school policy or a local ordinance to help prevent or restrict access or interest for young people to commercial tobacco products, we can provide free legal technical assistance, and that basically is legal research, policy development, implementation, and defense. So we can help with sample language and help with the implementation of those policies. We have a ton of publications on our website, and then we do trainings like this where we talk about a certain subject matter area and are always open to questions and follow-up technical assistance. So please feel free to email me at the end of this if you have any more questions, because I will be going over things pretty quickly. What we don't do is directly represent any entity or person or lobby for any specific piece of policy or legislation. All of the work that we do is based in the idea that equality and equity is a vital component to our work, and we believe that effective policy is equitable policy. And what that means as far as commercial tobacco is considering things like the social determinants of health. And today we're talking about K-12 policy. So under that social determinants of health umbrella, which is basically acknowledging that there are many factors, structural, institutional factors that have influence in the outcome of our health. And so under that umbrella of the social determinants of health are things like adverse childhood experiences, acknowledging not only what children are coming to schools with, experiences that they're coming to schools with, but how then school impacts them and affects them and their health outcomes as well. So when we're talking about K-12 policies today, please, I hope that you can see that, especially when it comes to things like how to address violations of the commercial tobacco-free policy, that understanding and looking at the student holistically is what we believe to be an effective way of addressing this problem of use in schools. And when it comes to commercial tobacco products, that means recognizing that the tobacco industry has, for decades, admittedly targeted young people, especially young people who are in low socioeconomic neighborhoods, young Black people, young Indigenous individuals, and LGBTQ individuals, young girls. And so acknowledging that what young people have to overcome, in addition to ACEs and the social determinants of health, is this intentional marketing by the industry to hook them on these products that they're then bringing into schools. And traditionally, when we've been talking about that, it's been about combustible products like cigarettes. You know, we have a corner store here on the screen across the street from a elementary school, and you know that we know that exposure to tobacco product ads at places like corner stores and other points of sale increases initiation and influences brand choice. And so when we're looking at statistics like who chooses flavored tobacco products like menthol flavored cigarettes, which is the graph on the right, we need to acknowledge that there are so many factors that go into those statistics and the use of those products. So I wanted to talk briefly about this vaping epidemic. So here on the slide, you'll see right now a chart showing the youth e-cigarette epidemic from 2011 to 2018. And even in 2018, you can see a tremendous spike in e-cigarette use, which is kind of towards the middle there in 2018. Now, when we look at the most recent data from 2019, it's gone up significantly still. And this is how, you know, we're here today talking about this youth vaping epidemic and use in schools. But I also wanted to mention here that you'll see an increase in cigarette use and use of two types. So that's dual use of two products at the same time. Also an increase in cigarettes in 2018 alone. So I think it's important to note that even though the K12 policy, the interest in that has certainly picked up because of the youth vaping epidemic, we need to continue to consider the addiction to combustible and other tobacco products. And also note here that, you know, when it comes to youth e-cigarettes, which I'll mention a little bit later, ways that schools can also address the problem is looking outside of the school environment and getting involved with local policy or state policy. And one of the things to think about is, you know, what can we do to reduce access outside of schools? One popular policy is Tobacco 21, but as we have seen from recent studies, is that youth are really interested in flavors for e-cigarette use, especially flavors like menthol and mint. And here is just, I'm not going to go over this, but this is just a brief kind of why we want to help children combat the addiction to nicotine. And this is the effect of commercial tobacco use, and specifically nicotine, on the young brain. And just to really acknowledge that, you know, these are young brains that are already changing, and nicotine is really impeding growth and making them susceptible to many different harms like increased risk of addiction. So we really, I think for us, have approached the K-12 best practices from a place of trying to help students who are suffering, or trying to help educate them so that they know what they might be getting into. And so schools can do many things to address these problems, including sending an advisory to parents and the community and guardians, education and signage, but today we're going to be talking about the policy piece. And so we have two model K-12 policies. The ones that I have on the screen are Minnesota-specific K-12 policies, but we do have national K-12 model policies, which should be released next week. They're just in the final stages of design. But basically, here's a summary of that policy. The comprehensive K-12 commercial tobacco-free policy has comprehensive definitions of all products and prohibits certain acts for students, for staff, and for anybody visiting the campus. And I'll go into more detail on some of those pieces. So this is an overview of all the sections in our model policy, and I'm only going to be touching on a couple of them given the limited time that we have today. So first, let's talk about definitions. So in the K-12 policy, definitions is an opportunity for education. And so it's really important that the definitions are comprehensive so that they're clear and they ensure better compliance. And so here you're really wanting to define where and when. So being very specific that you're talking about 24/7 all the time, commercial tobacco product possession and use of students is prohibited. And when you're talking about, you know, what the school property is, you're also talking about any off-campus school-sponsored events. So being very clear about the breadth of and scope of the policy. You also want to talk about who. You're not just talking about students, you're talking about staff as well, but who is considered staff? You might have contractors who are on campus for certain things, and you want to make sure that the policy explicitly includes those people. And so you'll see in our model that the definition section is very specific and provides examples to make them easy to understand. So let's also talk about the definition section and defining what is included, because this is very important when it comes to K-12 policy. Recent studies have shown that even teachers still, up until last year, had difficulty recognizing certain commercial tobacco products like e-cigarettes, and especially an e-cigarette like Juul, which tends to look like a USB flash drive. But now there are so many ways in which these e-cigarette products are being hidden, like in a hoodie or in a watch. And so it's really important that the definition section explains what e-cigarettes are, for example, and gives specific examples like Juul and Sorin, so teachers aren't having to play a guessing game when they're faced with these products in the classroom. The other thing that our K-12 policy covers when it comes to products are imitation tobacco products. So things like this can of beef jerky that you see on the screen, which mimics smokeless tobacco or chew, would be covered as a prohibited item under our model K-12 policy because of the industry's influence in making that an enticing product for students to start initiating commercial tobacco use. So we have these specific examples of imitation tobacco products, e-cigarettes, etc., in the definition so that it's easy for teachers to follow. And then generally speaking, the policy provisions themselves prohibit students and staff from possessing, using, and consuming commercial tobacco products, including lighters and tobacco-related devices, at any time on school property or at any off-campus school-sponsored event. So it's very, very clear what's covered and where that activity is prohibited. It also goes beyond just addressing the people who work and attend the school. It puts some restrictions on the schools themselves. So the K-12 policy prohibits schools or school districts from accepting tobacco industry sponsorship, donations, money, and curricula. And this is really important because the tobacco industry has historically targeted students in schools with quote unquote anti-tobacco educational materials or cessation materials, but really they've included subliminal messaging to actually entice young people to initiate or continue with commercial tobacco use. So the picture on the left is actually a book cover that Philip Morris sent out to several California school districts several years ago, I think about 20 years ago. And you can see it says, "Don't wipe out, think, don't smoke," but the snowboard itself looks like a matchstick. And so the California Department of Education and several other agencies came together very quickly to put a stop to this. But this is an example of how historically the tobacco industry has targeted students under the guise of anti-tobacco education material. And this is still true to this day. On the right, you'll see a clip of the congressional hearing of Juul's marketing strategies. And the students that you're seeing testifying here are talking about a Juul representative coming into their classroom, again, under the guise of, don't use commercial tobacco products, don't, smoke marijuana. And the things that the Juul executive was actually saying were promoting the Juul products. And so I would encourage you to watch this video if you have an opportunity. I did include the link here, but it just is an example of why it's important for schools to be protecting students from industry influence. And so there are a couple other regulations that it puts the burden on schools to ensure that they're enforcing the policy and really discouraging the use of commercial tobacco products. And so here's kind of just a really short example of talking points when we're getting into the idea of enforcement. And so we have a publication on alternative solutions or alternative penalties for when violations by students occur. So now we're getting into the enforcement piece. So in our model K-12 policy, we do not include punitive measures like suspension and expulsion. There are reports from all across the country of the skyrocketing suspension and expulsion rates by school districts for violations of tobacco policies. And when we are thinking about, again, the student as a whole and why they're engaging in activity that violates the school policy, like using commercial tobacco products, we really need to understand that the tobacco industry has targeted youth to maintain profits for decades, and how nicotine influences the brain, creating an addiction and making that addiction very difficult to break. And so from our perspective, any K-12 policy should include effective solutions that help the youth succeed, which the CDC has said leans towards education and counseling. And so punitive measures like suspension and expulsions don't do anything to address the addiction, and may actually, because of the effects of suspension and expulsion, which are summarized in our publication that I just mentioned, they may actually increase the likelihood of initiation and continued use of commercial tobacco products. One other thing I want to mention is that these type of punitive measures may result in disparate and disproportional disciplining. We already are very much aware of the school-to-prison pipeline and disproportional disciplining in school districts all across the country, and it's important to acknowledge that the studies show that the likelihood of harsher penalties for students of color, for example, students who are suffering from different learning abilities, they are up against it. And so it's really important that we're recognizing in a public health perspective how we're contributing to that. And so our policy and the memo that supplements the policy talks about that as well. So here's what it does include. It includes holistic solutions for student possession and use. And so these are just some options that schools can explicitly include in their policy, as opposed to punitive measures like suspension and expulsion, in light of all of the information that we have about addiction and youth. And so things like working with local public health departments, state public health departments, public health advocacy organizations to support student chemical health assessment, cessation and counseling, to provide programming within the school like student support groups, to get parents and guardians involved, and finally confiscating the products. And I'm happy to talk about the confiscation piece and how that would work for staff as well after the webinar. But we, in our K-12 policy, explicitly address cessation, and that the policy should support cessation through these partnerships with local public health department and other community-based organizations. But cessation support explicitly being included as a part of the enforcement piece. But like I said, there's only so much schools can do within their own environments. Many school districts are getting involved now with state and local policy, especially when it comes to tobacco 21, flavors, and licensing caps. You know, there's only so much you can do to keep products out of the school when they're available, when they're so available outside of the school environment. So point of sale policies like restricting the sale of flavored tobacco products, especially menthol cigarettes, like that graph I showed you earlier, limiting the location, number, and density of retailers, or increasing the price of products, which creates a kind of barrier for price-sensitive youth is important. And there are organizations to provide schools with support on all of this work. Like I said, local public health departments and public health advocacy organizations like the American Lung Association. We have other resources related to all the things that I mentioned today. We have a webinar and publication on Juul and the guinea pig generation, which talks about the rise of Juul and how it infiltrated the youth culture. And then we also have a publication called The Verdict Is In. There are several sections of that publication, but there's one section called Marketing to Youth, and it contains quotes from the tobacco industry about how they intentionally, historically, and continue to target youth in order to fill their dying consumer base. And that's helpful when it comes to trying to get these types of policies passed. here's my contact information. If you have any questions or you yourself would like to request technical assistance from us for school policy or just need some resources, I can send them your way. And now I'm open for any questions and answers if we have time for that.
Thanks so much, Natasha. I appreciate everything you shared. One thing I'm curious about is the extent to which schools have comprehensive policies in place. So in your experience, when people come to you for technical assistance, what's the state of policies that you come across? Do most schools have something pretty comprehensive, or really nothing? Can you talk in generalities for us?
Yeah, some school districts don't have anything, and I should mention also, I'm talking about school districts, but I could also be talking about charter schools or Montessori schools, private schools. We are willing to work with all of them. Some schools don't have anything. Some have not updated their policy in a very long time, and that's really important. So you know that you already have a commercial tobacco-free policy. Consider contacting us. We can take a look at it just to see if there are things you can do to strengthen the policy. Most likely, if you haven't updated it in the last 2 years, it probably could use some updating just because the tobacco products have changed. And so like I said, the definition section probably could use some work at least. So that's typically what we see, at least requiring some updates to the definitions because we have all these emerging products coming onto the market.
And if the school district were to come to you and say, listen, we can make some changes, but we can't do a full overhaul. We just don't, we don't have the support for it. How would you help them prioritize?
Yeah, great. So we can do any level of review and providing of sample language. So we meet people who are coming to us for technical assistance where they're at, and can provide resources if they want more information on how to go, if they would like to go further. But basically, what we would do is we could take a look at the sample language or the current language as it stands and make really basic updates like changing the definition or even adding a definition of e-cigarettes if you don't have that, and then making a comment maybe if you do have mandatory suspension for students who violate the policy and you don't feel that you have political readiness to change that, we are open to not changing that but adding a comment with resources to have a conversation about why that might be something that would be good for the school district, for example.
What are some of the common barriers you hear when you're working with schools on changing policy, and how, what are your suggestions to overcome those common barriers?
Yeah, so the biggest thing I hear is, okay, fine, you're telling us what not to do, but what should we do? So, we as public health lawyers, we don't have any programs developed to actually address violations like, cessation support and resources. But there thankfully are organizations who have been working on those types of resources and have now created them, and they're available to the public. So the American Lung Association developed a program called In-Depth. And it is a training program for schools. It's a toolkit for schools to basically use once you have a violation. So, okay, a student violated the policy. Now what do you do? That's ALA In-Depth has created an answer to that question for us. And so that's a big barrier that we hear. It was like, fine, we won't do that, but we don't have anything to do anything else. And so we have to suspend the student. Another thing that I hear is that schools don't know what to do with confiscated products. Teachers don't know how to store them. They don't know how to handle them. And then once they have them all together, schools aren't sure what to do with them. Sometimes parents are coming back into the picture and requesting that the schools return them, or really demanding that the schools return them to them because they're their products. And so this is kind of a longer conversation I'm happy to have with anybody who has questions about that. But there are actually federal and likely state guidelines for the handling and disposal of these products, and also on the return of confiscated items to parents and guardians. So I'm happy to talk about that, but I think those are probably the biggest two things that come up from schools when they're trying to make this work in a practical sense.
Understood. Well, I really appreciate all your comprehensive information. I urge everybody online to, if you missed the beginning, you can see it on our website and watch recaps of it. And we will be having another webinar next week at this time as well. So, Natasha, thank you so much for your time and your expertise. I really appreciate it. And we'll sign off for now. Thank you.
Thank you so much. Thanks, everyone.